Once we have her chart open, we'll proceed to the plan of care and we'll begin documenting a medication for this patient. In this scenario, we're going to skip or use none for the benefit plan information, and we're going to go directly to prescribing a medication for this patient. To enter a medication for this patient, simply use the medicine search and begin typing the name of your medication. Either the brand name or the generic will work. And here I want to prescribe Lipitor 40 milligrams. When I select Lipitor 40 milligrams, it immediately tells me that there are drug to disease warnings for this patient. And here I can see that the patient has hepatic failure designated on their patient problem list, and also the patient has disease of the liver. So this medication has triggered a drug to disease warning against diseases that are documented as current and active diseases on this patient's problem list. In order for me to proceed with this medication, I would have to override this warning and provide a reason as to why I'm overriding this warning. For now, let's just go take a look at this patient's current medication list, as well as the patient's current diagnosis list. Here we can see the current medications that the patient is on. We can scroll to the top to find other medications, and we can go to the assessment section to find the current active diagnosis codes for this patient. Here we can see that this patient has hepatitis C, pneumonia, congestive heart failure, along with many other diseases. Knowing this information, we can go back to the patient's plan of care and try to prescribe a different medication. If we were to prescribe a medication such as amoxicillin, we would find that this patient not only has a drug to disease warning against amoxicillin, but also an allergy, because this patient has a documented allergy to penicillin. Once we select a medication that does not provide drug to drug or drug to disease or drug to allergy warnings, we can go ahead and continue on with the prescription of this medication. Certain medications will also provide drug to drug warnings. Those warnings appear in the same way that the drug to disease and drug to allergy warnings appear. Drug-to-drug warnings also have severity levels. For example, this has a severity level 3, a moderate interaction, which is the lowest interaction level that is available. Other medications, when combined, will have different severity levels, including levels 2 and 1, where those warnings will appear in red. Drug-to-drug, drug-to-disease, and drug-to-allergy warnings are turned on by default in the EMR. These options cannot be turned off by the users and will be enabled during the entire duration of your reporting period and afterwards. The simple use of the MTBC EMR for electronic prescribing and medication documentation automatically triggers the drug-to-drug, drug-to-disease, and drug-to-allergy warnings. And that is how you will meet core measure number 2 using the MTBC EMR.